Hey, good Saturday afternoon. It's your afternoon girlfriend, Yvonne Daniels. I do hope that you are having a great day and so glad that we can go live today talking about a topic that we're still dealing with. Everybody's dealing with it, and that we are having to make sure that we're staying vigilant, staying safe, getting tested. So, yes, we are talking about coronavirus and COVID-19. So excited to talk about the pop up testing site that we've got going on that's going to be happening actually this Tuesday, July 14th. It's going to be at the New Birth of Missionary Baptist Cathedral, 3121 Sheridan Avenue, right across the street from Green Giant Market and the Saginaw County Road Commission. So we've got some great guests that we're going to have on today talking about just a lot of stuff, the testing and making sure that you know where to go and why you need to get tested and all of that. So let me bring on first Bishop Larry Campbell of the pastor of the New Birth Missionary Baptist Cathedral. Hey, Bishop Campbell.
Good afternoon. All right.
Yeah, and of course, this is where we're going to have the testing site on Tuesday, this coming Tuesday. And also, we want to welcome on Angelo Cap. Angelo is the former graduate of the Great Lakes Bay Hispanic Leadership Institute. He's also the vice president of the Latino Leaders for the Enhancement of Advocacy and Development Saginaw chapter. Hey, Angelo.
How you doing?
Fine. How are you?
Not too bad. I'm glad the sun's shining today.
Me too. I am too. So, because we definitely, the skies fell out yesterday, but
That's right.
so glad to have you guys with us today. And of course, we do have to stay vigilant. We do have to stay safe. And we do have to get tested. We see numbers spiking again, and we just don't want that to happen. And a lot of people just, don't know their status. And that is just very, very important. So we're going to give people a chance to make sure they know their status and just some different things that they need to do if they do get a positive result, negative result, all that good stuff. So we're just going to kind of get into it right now. So, Angela, we're going to start. We're going to get this first question to you. So who actually can be tested?
Well, that's a great question. At the Great Lakes Bay Health Center's testing sites, anyone can receive a test with or without symptoms. The good thing about that is you don't need a doctor's order, and also that there is no out-of-pocket cost. But you do need to bring your ID and insurance card. And if you don't have insurance, you could still be tested.
All right. That's great to know because I think there was a lot of confusion about that. So that is definitely good to know. And also, why should people get tested? Why should someone get tested?
The thing about this virus is that even if you don't have the symptoms, you can still have the virus and still be spreading it. It's important to find out your status so you can better protect yourself and your family and also your community. But most importantly, it's to get tested so you could go back to work and be out in the public more. Also, with getting tested, you can be a role model for your family and others that might be fearful of, finding out the results.
Yeah, very, very important. And also want to encourage you as you're watching us live, if you have a question, you can go ahead and put it in the comment section and we'll definitely get to your question. Want to get all questions answered, all fears taken away so we can make sure that we're getting tested and knowing our status. So put your question there in the comment section if you have one. All right. Definitely want to get to that. All right. So this next question is for you, Bishop Campbell. Some researchers say that men are more affected by COVID-19 than women. So why exactly is that?
Well, I found out, and this information is vital to the community. More men are dying from COVID-19 than women. Reason being heart disease, high blood pressure, liver disease, more common among men than women. Men's behavior may put them at risk due to more contact. Primary household providers, handshaking, attending sports events. Some sources say men are less likely to be concerned about their health-related issues compared to women. So men, we got to get tested. Yeah. It's important.
And the ladies can encourage their husbands and brothers and all of that to go out and get tested, right? Because it is so very important. So
very important, yeah. And this is nothing to play with. COVID is very serious. Yeah.
And I don't think that I mentioned also, but you are a COVID-19 survivor. So we are so glad that you survived that. So you definitely know how important it is to get tested, right, Bishop Campbell?
Absolutely. Yeah.
Mhm.
You don't want to have to go through that.
Yeah, for sure. All right, so making it available for you and trying to give you all the information. All right, so why is it important for racial ethnic minorities to be tested for COVID-19? Angelo.
Well, there's a huge disparity between African Americans and Hispanic Latinos.
Hmm.
The rates are higher because of underlying conditions such as diabetes, heart disease, lung disease, and those are linked to more severe cases of COVID-19. Also, the hospitalization for Hispanic Latino persons is 5 times higher than that of non-white Hispanics.
Mm.
Hispanic Latinos are proportionally affected by COVID.
Hmm.
Hispanic Latinos represent 8% of COVID cases in Michigan, but they
Hmm.
only make up 5% of Michigan's population. Multi-generation housing conditions also make it easy for the virus to spread.
Right, yeah. So definitely, because it's affecting people of color so disproportionately, we definitely have to make sure that we're getting out there and definitely getting tested. So thank you for that. All right, so Bishop Campbell, we know you've been through the testing. So can you tell us a little bit about how the testing actually works?
Well, the testing at New Birth on Tuesday, Great Lakes Bay site, we are drive-through, and you can stay in your vehicle. Staff will take your demographic information and insurance information. They follow all safety guidelines. Walk-ups testing is also available at the site, so you don't have to have a car. You can walk up right from the community.
Mhm.
The test use long, thin, narrow swab that collects a sample from the back of your nose. It just takes a few seconds. Now, a lot of people kind of leery of that test, but I tell you, it's very much needed. It's very important. So don't let that deter you from getting a test.
Mhm.
You'll be contacted by your doctor within 2 to 4 days with the results of the test. Those who have taken the test say it feels like when you are getting water in the back of your nose.
Mhm.
Yeah,
Oh,
very important to get.
yeah, very important. And no fear. Don't worry. It ain't gonna hurt. It ain't gonna hurt long.
I'm still here.
There you go. All right. So so some people are saying, so what if I get a negative test result? What does a negative test result mean, Angelo?
So a negative test most likely means that you don't have the virus now, but you could
Mhm.
still become infected and have symptoms for a few
Okay.
days. Also, it's important to wear face coverings in public and you know maintain social distancing of 6 feet or more, and also keep your hands clean. I keep a bottle of hand sanitizer in the car with me wherever I go.
Yep. Yep.
And also, don't touch your face and make sure that you're using that hand sanitizer.
Yeah. Yeah. And I've seen too that I just bought a pack of, they have sanitizing hand wipes now that have like, I think 75% alcohol. So there, a lot of things are being made available so that we can continue to sanitize. And like you said, wearing those masks, I'm so glad that the governor has made it mandatory and has told these businesses that they can refuse service if people come into their businesses that don't have face coverings. That is just so very important. So thank you so much for that. All right. So according to the Michigan Department of Health and Human Services, there's an alarming rate of course, racial and ethnic disparities in COVID-19 cases and deaths. We talked about that a little bit earlier. As of April 19th, 2020, African-American residents comprise 33% of cases and 40% of deaths due to COVID-19 in Michigan, despite comprising only 14% of the state's population. So why is it important to bring COVID-19 testing and education awareness to our community? Bishop Campbell, what do you think? What do you
You know, we
think of that?
we feel it's important to provide culturally appropriate health education messaging, especially to our Black and Hispanic communities, that will help to encourage people to get testing. We can do this through utilizing venues such as this with other social media outlets, faith-based community leaders, identifying other community ventures. By doing so, we can provide health education materials that use appropriate language that is easy to understand and promote positive health messaging. Educating healthcare providers and making them aware of how their own subcultural bias may impact cultural practices and the importance of providing a supportive relationship, recognizing the social issues and quarantine as well as other recent activities that make it difficult for some people to feel comfortable enough to want to get tested. The reasons we are bringing testing to this particular location is that we are very conscious of the fact that transportation in our community is especially limited. Now the COVID-19 emergency order, people are not able to get to their regular medical appointments to obtain their medications from the pharmacists through the school closures, as well as difficulty accessing the grocery store, is why we selected this location. It's important to meet people where they are. Right in the community, the Sheridan area, the Sheridan Plaza area, the schools, and also the neighborhood. Right in the neighborhood, you can walk to the church and access the testing site.
Yep. And that's definitely important to make it convenient for people to be able to get to these testing sites. So glad that we are being able to do it right there on Tuesday. So also, you know, I think a lot of people just, they don't think this thing, they don't understand how serious this is. They can't with us, you know, some of the things that we're seeing. So what are the risks of a COVID-19 infection? Angelo, what are some of the risks of COVID-19 infection?
Well, the scary thing about this virus is that anybody can get it. It doesn't discriminate whether your bank account has, you know, lots of zeros in there or a dollar. It doesn't discriminate against your skin color.
Yep.
You're more of a high risk if you're older, you have diabetes, you have high blood pressure, heart disease, kidney disease, lung disease, asthma, and other health issues. The important thing is that if you feel sick, you need to take action to protect yourself and others. And if you have difficulty breathing, you need to get medical help right away. The most common symptoms are mild, and then they start off slowly. They can include fever, dry cough, difficulty breathing, tiredness, aches and pains, runny nose, nasal congestion, sore throat, and diarrhea. Other less common symptoms can include chills, muscle pain, headache, and new loss of taste or smell. Some people can also be infected and don't have any symptoms. So if you're unsure of an activity that might put you at risk, please call your healthcare provider or look at MDHHS website on COVID-19 for more information.
All right. Very important. And we've seen some cases. I've heard of some celebrities that had no symptoms. I think D.L. Hughley had no symptoms, and he wound up falling off the stool at one of his comedy sets and passing out and tested positive for COVID-19. So you're right, you can not have any symptoms. So it is definitely very important to get tested. So once again, got that testing site coming up Tuesday, 10 a.m. till noon at the New Birth Missionary Baptist Cathedral, 3121 Sheridan Avenue. Okay. All right. And so also remember, too, if you've got a question, you can put it in the comment chat there. We definitely want to get to any questions that you have to clear up anything that would prevent you from getting tested, because that is the number one thing. We've got to make sure that we are continuing to get tested so we can know our status. OK. And so finally, how can folks find help to stay safe and healthy? And I'll ask both of you, Bishop Campbell and Angelo.
First thing that we could do is utilize our 211. Basically, call 211 from any phone for a list of statewide resources from anything from food and diapers to rental assistance. I know right now everybody's might be on unemployment or looking for work, but that's a great way to get resources. Another avenue is to stay informed about COVID and the most recent safety measures, especially with the governor implementing the new state law with face masks being required. That's very important. And also, don't put off medical and dental care. Offices are still open for in-person visits, and call your healthcare provider to find out about rescheduling visits. I know I had to go to the doctors a couple of times, and they ask you three simple questions: Have you been infected? Have you had any symptoms?
Mhm.
And have you had any fevers? And it's easy to get care still during this time. So I encourage everybody to still, take care of yourself.
Cool. All right. Bishop Campbell.
Great Lakes Bay Health Centers, primary care provider for more than 56,000 patients at 30 locations across the region. They provide medical, dental, and behavioral health care for anyone seeking services. So help is available if we just reach out and use the resources that we have, regardless of coverage, virtual visit, continuing through telehealth, but they also are opening with safe protocols in place to keep patients and staff safe. Everyone must wear a mask to enter a center. Visitors are limited, and we will screen everyone for symptoms. Reach out to your healthcare providers for behavioral health needs, including ways to cope with increasing stress. All Great Lakes Bay primary care sites offer integrated behavioral health services counseling. For more information, visit www.greatlakesbayhealthcenters.org.
Okay. Thank you very much for that.
I
Yeah.
just want to add one thing.
Yes, sir.
One thing people do is once they have symptoms, they wait.
Mm.
That's the wrong thing to do
Yeah.
with COVID. You can't wait because the disease, the virus, will have a advantage on you then because it started working on your organs,
Mm-hmm.
and you want to get help as soon as possible. So if you get the symptoms, sore throat, high fever, loss of taste and smell, get to some health providers who can give you advice about it. The longer you wait, that's the advantage that the virus has upon your body.
Mm-hmm.
That's why a lot of people stay in, trying to get recovered because you allow the disease to get a head start on you. So it's important. As soon as the symptoms hit, then you need to be tested so you can get some help.
Yeah, yeah. And don't let fear get in the way of that, because like you said, it's going to start wreaking havoc on you. You got to get something done. So, okay. But we want to start off and want to make sure that you may not even have to get to that point, because if you get tested and you know your status, you can get in front of that thing. So we want to make sure that we give you a chance to do that once again this Tuesday, July 14th, 10 a.m. till noon. Going to be at the New Birth Missionary Baptist Cathedral, 3121 Sheridan Avenue, where Bishop Campbell is the pastor there, right across from you said the Saginaw County Road Commission.
That's right.
All right, and Great Giant Market, right? So
can't miss it. Big church on the right.
There you go. The walk-up testing is available. You can also get it done. You can drive through. All you have to do is bring your ID and your insurance card. If you don't have your insurance card, you can still be tested. So do not let that get in the way. Okay, we want to see you out there this Tuesday. All right, getting tested so you can know your status.
Yes.
It's been a pleasure. And Angelo, Cap, I thank you so much for talking to me. Is there anything else that you want to say before we get out of here and meet folks over there on Tuesday?
No, I'm good.
I would just like to add some stuff.
Okay.
Check Facebook. There's lots of food giveaways going on still, and look after your neighbor.
Yes.
During this pandemic, we're all in this together, no matter what your religion is, your sexual preference, your race. We all have to look out for one another. And I just like to say God bless to everybody out there.
Yeah, Angelo, you are right. We are our brother's keeper. So thank you guys so much. Once again, can't say it enough. Tuesday, 10 a.m. till noon, New Birth Missionary Baptist Cathedral, 3121 Sheridan Avenue. Come and get tested and know your status. All right. Thank you, gentlemen, so much for being with me today. And you all have a great rest of your weekend. And I'll see you Tuesday at the testing site. Okay.
Okay. All right.
Yep. Thank you.
Thank you.
Bye.
Bye-bye.
Bye.